Doctors, nurses, and admin staff are overwhelmed with more than just patient care. There's appointment scheduling, there's insurance claims, there's patient follow-ups, and then the actual care itself. So yes, medical professionals are stretched thin and they have a lot on their shoulders. However, there's a new type of healthcare hero stepping in to help streamline operations, and that is a virtual assistant. And recently we have worked with a couple of medical establishments who have seen tremendous success with virtual assistants. So in this episode, let's look exactly at what a virtual assistant can do for you so that you can focus on what matters most. Doctors, nurses, and admin staff are overwhelmed with more than just patient care. There's appointment scheduling, there's insurance claims, there's patient follow-ups, and then the actual care itself. So yes, medical professionals are stretched thin and they have a lot on their shoulders. However, there's a new type of healthcare hero stepping in to help streamline operations, and that is a virtual assistant. If you're watching this episode, you might not know who I am. My name is Valentina Brega. I am the host of the show Built with VAs, and on this show, we talk about how we can scale our businesses with virtual assistants. And this is the first time we're talking about the medical field, because typically we talk about real estate or other businesses and how virtual assistants can come in and can streamline operations. But we never talked about the medical field, so you might not know who we are. I have a company called HireTrainVA, and we hire and we train virtual assistants, just as the name suggests. And recently we have worked with a couple of medical establishments who have seen tremendous success with virtual assistants. However, they didn't know that they could hire VAs for a lot of the roles. So I said, I should make an episode on that. I should make an episode on exactly how you can incorporate a virtual assistant into your practice to make things easier, smoother, and just overall better. So in this episode, let's look exactly at what a virtual assistant can do for you so that you can focus on what matters most. Okay, so let's dive right into that. So the first thing that you can have virtual assistant do is scheduling and appointment management. So scheduling is one of the most time-consuming tasks in any medical office. Virtual assistants can actually efficiently handle appointment booking, rescheduling, and even cancellations. They can also send reminders to reduce no-shows and to optimize the schedule so that every hour is maximized. Now you might be thinking, okay, well, I do have an office staff for that. So think about this. With a VA managing your calendar, your front office team can actually focus on patient interactions rather than the phone. So this is a much better customer service for your patients who are already in the office. And the virtual assistant can handle that in the back end. I actually recently called I think it was a hospital or a big establishment, and I recognized that I was speaking with a virtual assistant. The appointment, the scheduling, the cancellation, every time I had to reach out, I was directed to a virtual assistant. So when I actually went to the hospital, it was for my daughter's birth, when I gave birth to my daughter. So when I actually went to the hospital and I had to go through this, whole medical procedure, the people on the phone had no idea how many times it's scheduled or rescheduled or anything like that, because it was all taken care of by a virtual assistant being in a different part of the world. The second thing the virtual assistants can do is they can handle patient inquiries and follow-ups. Patients often have questions about procedures, treatments, and test results. And virtual assistants can help manage patient inquiries by providing basic information and forwarding more complex questions to appropriate staff members. I recently had this question when I called a medical facility and I said, hey, I can't access my portal to see my test results. And it was a virtual assistant that helped me. It's like, okay, this is how you do. Let's make sure you have this. I just resend it to you via email, or click on that link. What do you see? Nobody in the office actually had to do it because this was given to a virtual assistant who was being on the other side of the planet probably, but it's just unnecessary task for someone in the office to do when there's a better way to do this. In addition to this, VAs can handle follow-ups. They can ensure that patients receive timely reminders for upcoming appointments. They can make sure they follow up with medications or post-treatment care. Number 3, streamlining billing and insurance claims. Medical billing can be tricky. It can be quite intricate with specific codes and policies that require careful attention. Virtual assistants trained in medical billing can help process insurance claims. They can follow up on unpaid invoices, and they can manage patient billing inquiries. So by offloading all of these tasks to a VA, medical practices can reduce errors, they can get paid faster, and they can keep their revenue cycle running smoothly. Not to mention that, yes, you can hire someone here in the States to do the same, but hiring a virtual assistant is oftentimes more cost effective than hiring someone locally for the exact same task. Number 4, managing medical records and data entry. So accurate record keeping is crucial in healthcare, and it can be very time consuming for the staff. So a VA can assist with data entry, uploading medical records, and ensuring the information is logged accurately. Many VAs are familiar with electronic health records, EHR, right, systems. So it makes them valuable assets in keeping patient data organized and up to date. So if you're looking to hire a virtual assistant, don't just hire anyone. Hire someone who already has that experience. And here at HireTrainVA, this is what we're experts in. We will find people with the exact same knowledge, with the exact same background that you're looking for. Number 5, assisting with admin tasks. Virtual assistants can take on many more administrative tasks or responsibilities, such as email management and preparing reports to even ordering supplies, you name it. I always say that if something can be done on a computer or on the phone, it can be done by anyone, anywhere in the world. So think about how powerful this is. We live in a world where the technology is so advanced, we have everything at our fingertips, and we can literally outsource our work to anyone, anywhere in the world. But besides that, virtual assistants can even provide HR support, such as onboarding new members, managing different processes, and so on. So when you delegate this task to a virtual assistant, medical practices can free up their in-house team to focus more on specialized work. And there are already a lot of medical practices who do hire virtual assistants. So if you don't have a virtual assistant, then what are you waiting for? You might have some questions. Put them in the chat. Put them here in the comments. I don't know how you're listening to this or maybe you're watching this on YouTube, but put it in the chat. What questions do you specifically have? Or get on a call with us. What's holding you back? Maybe you don't know how this works. You have a ton of questions, and that's normal. And we'd love to make sure we address those questions, because we have worked with other medical practices who have successfully incorporated virtual assistants into their teams, and would love to do the same for you. But let's get back to our list. Number 6, virtual assistants can provide a personal touch in patient care. Let me explain. So when virtual assistants handle routine tasks, medical teams can spend more time building meaningful relationships, right, with their patients. So many VAs can also perform follow-up calls to check on patients after procedures, answer questions, and provide a caring touch point outside of the clinical setting. So this added support can significantly enhance the patient experience and encourage patient loyalty. I would have liked it if my medical practice could, I'm actually going to have to talk to them about this, don't I? Yeah, I'm going to have to reach out to them. But I would love it if somebody just followed up with me after a week or certain procedures, or just to make sure I'm okay, or if I'm taking my medication right. I've never had any issues with that, but you would be surprised how many stories, and I'm sure you know about this, friends that I have in medical field who say, like, people don't take the medications the right way, or they don't know how to do this, or they just need reminders, or maybe they're just elderly and they need somebody to connect with or to remind them of certain things. So virtual assistants can help with that. Did you know about this? So number 7, a virtual assistant can improve efficiency and reduce costs. So I'm not sure you know this, but hiring a VA, it can be a lot more cost effective than hiring someone in-house here in the States. And that way, you as a medical practice, you can save on payroll expenses and avoid the costs that come with training, benefits, and office space. Virtual assistants don't need space. Benefits are not required. They're nice to have, but they're not required. And the training, it doesn't have to be expensive. And a virtual assistant is an assistant helping you. And they usually come with their technology, with a workspace, with everything you need. And of course, they come with experience in the position they apply for. Plus, with the flexibility of VAs, you as a practice, you can scale your support as needed. You only pay for the hours you require, and it's very controllable. Okay, so that makes virtual assistants an efficient, cost-effective solution to healthcare providers looking to improve practice management. So I hope I planted some good seeds and got the gears turning, and you may be thinking about how you can use virtual assistants. Now let's say that you found someone. How do you integrate this virtual assistant into your practice? Let's look at that as well. Here's a step-by-step plan how you can do this. Number 1, understand your needs. Understand, this is like business, right? This is just like a business. We do a lot of business consulting, and I always say this: understand your needs, your business needs. What is the pain point now? What are the areas of your practice that need more support? Is it scheduling appointments? Do you think people are not being followed up with? Is it insurance claims? What is it? Is it collection? What is it? So once you identify your need, then you're going to research VA providers. You can hire virtual assistants on your own, of course, but I'm going to let you on a little secret. In our company, we have to interview 100 people to select one good one, maybe sometimes 2. But basically, out of 100 people we speak with, 98 or 99 are not good enough for us, because the majority of people, and I hate to say this, but the majority of people who apply to work as virtual assistants are not good. But once you find the good ones, they are a complete game changer. And I'm pretty sure that if we did the statistics here in the States, we'd probably have the same thing. Probably the majority of people who would apply would be disqualified. They would not be good enough. So it's not necessarily a VA versus the local thing. It's just the way things are when you hire people. So you can hire on your own, but just be prepared to have an inbox flooded of applications, and you have to go through each one of them and hopefully to find the right person on the first go. Or you can use a VA provider. There are tons of companies out there, and we are one of them. And I don't know how other companies do this, but I can tell you what we do. Like I already said, how many people we have to interview to find one or two good ones. But this is what we specialize in. We specialize in finding the right people, meaning we check personality tests. We actually call previous companies or previous practices they work with to get a true unbiased opinion, unbiased testimonial of what that person was like, what that virtual assistant was like. So we check references, we check personality test, we check IQ level, we check their English level. People have to go through a lot of hoops to pass our selection criteria, but only the best ones get selected. So it might be wise to partner up with someone like us, or maybe even us, that could help you find the right virtual assistant. What do you do from here? Check credentials. Let's say if you hire someone on your own, definitely check credentials. Put the VAs to a test. Put them, like, if they're going to be responsible for appointment scheduling, give them tricky situations and see how they would navigate those. If they can think on their feet, or if they can think outside the box, or, just what is it that you need, and put the VA in that situation and see their logical process. Also, make sure they are trained. So test their trainings. Look at their resume. If they said they have experience in ABC, put that to a test as well. Here at HireTrainVA, we never hire anyone without testing their credentials. So we do put them to a test, and then if someone needs training, we can offer the training for certain roles as well. And then after you've done this, let's say you have found a virtual assistant, you're ready to bring them on board. Start small. Don't dump everything on their shoulders at once, because they will be overwhelmed. And even if they have a ton of experience, they still need to get used to you as a person, to you as a practice, to you as a team overall, to you as a brand. So give them this time to ramp up, to get used to you. Start small. Begin with 1 or 2 key areas that they will be responsible for, and from here gradually expand the VA role. So I usually like to have a 30, 60, and 90-day plan when I bring a person on board. This is what you're going to be responsible for the first 30 days, and this is what kind of results we'd like to see. And then from here, if successful, this is the expectation for the next 30 days, and then the following 30 days from here. And last but not least, monitor and adjust. Regularly assess the impact and make adjustments as needed. Give people feedback. They need to know that feedback. People want to do a good job for you. They do. Everybody wants to do a good job. Everybody wants to be successful. We get a lot more fulfillment when we know that we're contributing positively to someone's business rather than we're kind of in the limbo. So give people feedback, monitor their work, adjust if necessary, and give them some time to ramp up. I know this works. I've seen it countless times, this working. It's not about whether this works or not. I know it does. So let me know what questions you have about this, and I'll be happy to assist you with that. So if you don't have a virtual assistant for your medical practice, really give it a thought, because this is one way to stay competitive in today's market. And a lot of other practices are already using virtual assistants. So thanks for tuning in. It was so great coming here and talking about this. As always, get on a call with us, let us know, and I'll see you next time. Bye.